topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Florida. Welcome to another Ask the Expert show. I am so excited today. We have gotten all your emails, and I know you've been asking for us to do a neuropathy show. You've asked us to do a Medicare show, but Medicare is so dear to my heart. We were able to find our New Jersey Medicare specialist who also handles Florida. I am just so thrilled to get him, even if it's in the middle of everything. Hey, good afternoon, Stephen From.
Good afternoon, Steve. I appreciate it again. You having me on the show means a lot to our company. So thank you very much.
Hey, bro, first of all, your sign looks really good behind you. I got to give your wife credit for that one.
Yes. Judith has a hat, sweatshirt, sign. She's the one who designs everything. Things don't happen without her.
Well, I got to tell you, we had somebody from New York who spends half their time in Florida and saw that you were going to be coming on the show today. And she said, you know what? This just reminded me, I haven't taken care of this yet. And she said, I'll be down there in a week. I know it's got to get done. I will be calling him if you think he's the best. And I'm going to tell you something. Just looking at his New Jersey show, Stephen From is, without a doubt, the best agent you could possibly have. Stephen, tell everybody about your company.
Well, again, thank you very much for the opportunity. We're here to help families and make a difference. I think I mentioned in the New Jersey show, mortgage business for 20 some odd years, got into elder care. My grandmother forgot who I was. I'm a certified dementia practitioner, certified senior advisor, got in healthcare, and then saw the need for an insurance and a crossover. So I decided to open my own company in 2018 and never looked back. It's been great making a difference for all these seniors and, positive difference in their lives. And we enjoy what we do.
I got to tell you, Medicare Advantage plans are a major change that's affecting roughly 3 million seniors. Talk about that.
So it's a great question. We're following up from the Jersey show. We talked about how the changes in Medicare Advantages with various carriers no longer offering plans or service area changes. I did a little more research. It's going to affect approximately 300,000 seniors in Florida.
Wow. And, I'm going to tell you something. I felt so stupid being so uneducated. That's why this show was so important, because I went on Medicare several years ago, Stephen, like I've told you before, and I did not know anything about Medicare. In fact, a friend of mine had to tell me. So that's why a show like this is so important. So this show is for the Florida listeners. And first of all, explain to everybody what Medicare is.
Well, Medicare is a government insurance program, and there's two types. You have original Medicare, as well as you have a Medicare Advantage plan. Original Medicare, you have Part A and Part B, which is for your hospital and your doctors. And then that covers about 20% of all your costs. And then with original Medicare, you enroll in what's called a Medicare supplemental plan. Those are 10 different plans offered by the government. Each carrier has to offer those plans. And that helps you pay for the remaining 20% cost for any medical procedures. There are some, deductibles sometimes, but that covers the majority of the cost. And then you have the Part D prescription drug plan. That is where, different carriers have different costs as well as how they cover drugs. So we do a needs analysis with every senior to understand, what is best for them. Then you have Medicare Advantage plans, which are all comprehensive. They include Part A, Part B, as well as Part D plans, and they offer some ancillary benefits such as dental, vision, and hearing, and something we spoke about last time, over-the-counter benefits, which can help a lot of seniors sometimes.
I tell you what, there's something that you told me was so scary. I've told you before, I'm on Humana's Advantage plan, but Humana is dropping a lot of different counties, which who would think? I would think Humana, they wouldn't be dropping out of any county. But from what I understand, they are dropping out of some counties, and people need to know that just because you were with, say, Humana last year, I mean, be with them this year.
That is true. As I mentioned, a lot of carriers made the decision to not offer plans in certain areas. So there's been a lot of service disruption. We tell everyone to, during this AEP time, to make sure they contact us, so we can review their plans and do a needs analysis. Unfortunately, not every senior is aware sometimes that their plan is no longer going to be offered in that area. They may have missed some mailing that was sent to them. So it may be a surprise when they call me to review everything, and I have to inform them that, hey, listen, your plan is not being offered anymore. So we have to work through that and, find the right plan that's going to cover their doctors and their prescriptions for them.
So, Stephen, there's so many different parts of Medicare, and it looks like most of the questions that are coming in are, what does each one cover?
That's another great question. As I mentioned, Part A is for your hospitals, Part B is for your doctors, and then the Medigap plan or Medicare supplemental plan, again, that is offered by all of the carriers or different plans. For example, Plan G, Plan N are just two examples of those plans. And again, that helps cover that remaining 20% cost that the original Medicare A and B does not cover. And then you have your Part D prescription drug plan, as we mentioned. And as I mentioned, the Medicare Advantage plan is all inclusive. Everything is included in that plan, as well as some of the ancillary benefits for the seniors and over the counter. The one difference is with original Medicare, there is no dental. So that's one thing that we educate all the seniors about. Hey, listen, there's no dental coverage, and we do work with a lot of carriers that offer dental plans. So again, it's all about educating everybody.
So here's a great question that just came in. Do you have to sign up for Medicare when you turn 65?
That is another great question. Yes, you do. Now, again, the person could be working for a large employer, so they may be able to delay Medicare. That is a case-by-case basis and something we would look at. When you turn 65, you have what's called your IEP. That is, you have 3 months before your birthday, a month of your birthday, and 3 months after to review your Medicare plans and get enrolled, for example, in a Medicare supplemental plan. And during that period of time, it's called what's called guaranteed issue, meaning that there are no health questions being asked of you at that point in time, so you can enroll in your Medicare supplemental plan. Also, you can enroll in your Part D prescription drug plan. There's various case scenarios. If someone does not enroll and maybe does not have credible employer coverage, there could be lifelong penalties if they do not enroll in time.
I know about that, Stephen. We had, it doesn't matter who it was, but we had someone who told us Obamacare, you would get to keep your doctor, which turned out not to necessarily be true. So we're getting questions, people going, do I get to keep my doctor if I switch to Medicare?
Again, another great question. With the software packages that we use, we're able to put all the doctors in for Medicare Advantage, for example, put all the doctors, put all the medications in to make sure your doctors are in network with a Medicare Advantage plan, as compared to original Medicare. You have to make sure your doctor is taking Medicare, but it's a different situation. So that is a great question as well. Really pertains to a lot of Medicare Advantage plans at this time.
Stephen, could you, especially for new people, Can you talk about the cost of Medicare?
Sure, that is another great question. Part A, depending on whether how you work, what your work history is, that could be free for you. If your work history doesn't meet the certain parameters, there could be a cost for Part A. Part B, right now, for example, is $185 each month, and starting in 2026, that is going to $202.90. Medicare supplemental plans, it depends on your service area, the demographics for the various companies. The various carriers do charge different premiums for the same plan, and that is one thing we look at and we discuss with all the seniors, as well as regarding Part D plans. The cost for carriers is different, how they cover the drugs is different. So it's very, very important that we do those needs analysis and we educate the senior. Compared to the Medicare Advantage plans, there are a lot of Medicare Advantage plans that offer zero premiums, which helps a lot of seniors. However, they need to be educated that if you go into the hospital, there may be a cost involved. If you take an ambulance ride, for example, there may be a cost involved. So there is an out-of-pocket maximum for those plans. And again, you need to walk through the seniors so they understand the difference for everything.
I want to share this with all of our new listeners and viewers for Florida. I love Medicare. I've told you this before on our New Jersey show that we do. I think it's the greatest thing. It's worth all that payouts we've done our whole life. But I want to say this, Stephen. This is so important. I had a horrible agent the first go around. This guy just basically didn't do any homework, any due diligence. And there's so much to find out, Stephen. There's so much work that you do. And people don't even have to write you a check. But I just want people to know, I think you are just our 2 or 3 shows we've done. I wish I would have had you in the beginning as my agent because I wouldn't have gotten screwed so bad.
Well, thank you very much for that. We work hard. And as I mentioned, we're here to make a positive difference in everyone's life. The beginning appointment for me is always an hour. I always take at least 1 hour with the senior to really understand what their healthcare needs are and their doctors and medications, and really break down with them all of the costs of Medicare, be it original Medicare or Medicare Advantage plans. And one of the big things I had it today was explaining the different supplemental plans to a senior and why the different costs are associated. Again, it's just taking that time to make sure they understand everything. And for me, I'm helping them not just today, but they're my client for life. That's important to me.
What happens if a person is still working, Stephen, and they already have health insurance to do their job? Can they still do Medicare?
They can if they like to. Again, that is a really important needs analysis question, looking at the size of the employer and how many employees have. In certain situations, they may be able to delay Part B premium for a while since there is a cost associated with that. And then, I had a situation today, matter of fact, the credible coverage for the employer is ending, and the senior called me up because they need to enroll in a Medicare supplemental plan as well as a prescription drug. And before the call today, they already had enrolled in Part B for themselves. So that was very helpful because a senior needs to be enrolled in A and B to, get enrolled in the Medicare plans.
We better talk about the open enrollment because there is a window and it's we're about halfway through, right?
Correct. It ends in December 7th. So it started on October 15th, ended December 7th. So I think we have about 2.5 weeks still to go. And I will say that I've been fielding a lot of phone calls this week with a lot of people calling me up because they have yet to do anything. And the changes that they make will be effective on January 1st. It's a great opportunity for anyone, be it original Medicare or Medicare supplemental plan, to call us and take the time to review their benefits and make sure the doctors and prescriptions and the care is what they need for their current healthcare needs.
I want to remind everybody, if you have a family member or a friend in the Florida area that is about ready to go on Medicare. This is such a great show. You can go into YouTube or iHeart or Spotify under Ask the Experts Medicare Florida, and they can watch the show again. What's the biggest question you're getting now, Stephen?
The biggest question we're getting now is, why have the costs gone up so much? The terminology I'm using at this point, I'm just saying medical inflation. It's a very broad term. And, it's the costs have risen so much with respect to prescription drugs, for example. The premium costs have gone up significantly for a lot of the carriers, affecting a lot of the seniors with respect to, hey, can I afford this premium anymore? As well as, hey, are my drugs being covered with this carrier anymore? And again, that's where we do our needs analysis to really understand everything. And maybe there's an opportunity for them to change a plan. It depends, again, doing our due diligence and helping them understand what their needs are.
Here's a text from Emily in Boynton. Can you explain the difference between HMO and PPO, and which one do you like the best?
Well, that's a great question. With respect to that question, it's really not a matter of what I like best. It's more of a matter of what best fits that situation for that senior. HMOs, as you know, you're in an HMO. It's more of a network. As you said in the one show, you enjoy your HMO because your doctors and your specialists are all right in that network, and it works for you. With respect to a PPO, there's a larger network. You can visit other doctors and specialists. It gives you more flexibility, I would say, being in a PPO. But again, I'll always come back to what are the needs of that senior, what's going to work best for them. So I really can't say which I prefer because, again, it depends on the situation of the person I'm speaking with.
Stephen, tell people how they can reach you.
Sure. Thank you very much. Well, they can reach us by going on our website, which is www.myLastNameFrom.com, or they can reach out by giving me a call or texting us at 908-510-3418.
We just got a quick text in. Do you also do healthcare?
Yes. So I guess we're speaking about under 65 healthcare. Yes, we specialize in that as well. That is definitely a rapidly changing environment based on what the government decides to do with respect to healthcare subsidies, which are used to offset premium costs for those who are looking to be insured. That is a changing environment dramatically right now, dramatically.
Well, I promise everybody we'll be doing a show just on healthcare after this is over with. Hey, Stephen, I'm sorry about the short version, but we're going to make it up to you next month. I'll email you about that. We're so glad to have you, folks. I don't endorse a lot of our experts. Steve Fromm, I do. If you need Medicare or health insurance, give him a call. Hey, Stephen, we'll see you next month. Have a wonderful Thanksgiving and look for my email this afternoon.
I will. Thank you again for the opportunity to be on your show. Have a great night.
Love you, bro. See you.
Take care. Bye-bye.
We're going to go to a short break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.